Yesterday is not what I would call a good day. It was actually a very bad day. And you see, it all started out fine. I was going to my normal PCP appointment and I had to get an EKG, which is totally normal because I have to get one every once in a while because of a medication I'm on, just to be sure. They've always been fine. Never had any heart issue. And it's like usually okay and then leave. Well, yesterday I did the EKG and I felt totally fine. And he's came back and he's like, "You're like tachycardic." My heart was racing at rest. I didn't even feel it. Like, I didn't feel my heart pumping like super hard where I'm like, "Oh yeah, my heart's racing." I had no idea. And then he was like, "This is weird, like, okay, we can't put you on this kind of medication because it'll lower your heart rate, but it'll lower your blood pressure, and your blood pressure is already super low, so you'll pass out. Like, it won't be good." So he's like, "I don't know what to think of this." And there were two doctors talking to each other, trying to like figure it out, like, what is this? Like, why all of a sudden? Then I went to leave. Well, I went to leave, and as I walked out of into like the waiting room, I felt this chest pain. And it was like the middle of my chest to the left to my shoulder, like in here. And my eyes got like my eyes didn't change, but I had like a look in my eyes, like, something is not right. So I went back in and I just stood and like looked at my doctor because he walked down the hall and he's like, "What's wrong?" And I was like, I don't feel good. And he was like, "Okay, come sit in here." And my heart was still racing. I could only tell if I go like this. And I was just in so much pain. Like, I had to either lean over or sit up. Like, I couldn't, like, laying back, it was hard to breathe. I was breathing very shallow. And we were just gonna like wait it out and see, and it wasn't getting any better. So he called a cardiologist he knows and said that I had to go there immediately, and made like an appointment that's not scheduled. I've never been to a cardiologist. So we went right there to like the hospital to try to figure this out. And I guess we kind of figured it out. We don't know why yet, or if we will ever know why. But she was like, "Yeah, I'm glad you came in. This is not right. Your doctor doesn't call over here for no reason." And they did another EKG. It was still like really fast. I had no anxiety whatsoever. I was worried they're gonna say, "Oh, well, have you had any like things going on?" And it could be like, "Oh, well, my parents were divorced, or are divorced, I'm moving, that's stressful, but I wasn't gonna say any of those things but she didn't mention stress once, and she asked about all these symptoms, and I was like, yeah, oh my gosh, it feels like there's so much pressure, like something's sitting on me like this, and it hurts to do this, and it feels better to do that. And she was like, her and a nurse practitioner asked about my Lyme disease, like if it was a past thing, and I just looked over at my mom because it's hard to bring up Lyme disease to any new doctor because they'll be like, "Okay, so you were treated for that eight years ago. Okay, so that has nothing to do with anything." But she said, was it acute or is it a chronic thing?" And that's when I was like, "Oh." And I was like, "Yeah, it's a chronic thing." And we started talking about chronic Lyme disease, and she's like, "The doctor said believe it, or don't believe it, and they say it doesn't exist, and there's all this. She goes, absolutely ridiculous. I've seen what Lyme disease has done to people, and it causes so many problems, and people don't open their eyes. And I was like, okay, I like this doctor. Anyway, so after learning I could mention Lyme disease and things to her, and all of my other medical history, we kept talking, and she diagnosed me with pericarditis, which is not good. It's inflammation around like the lining, like the sac around your heart. Why is it inflamed? It hurts so bad because there's inflammation, and your heart rubs against it, and that hits like more inflammation because it's inflamed and like getting in the way, I guess you could say. But I was like, what? So now I have a heart condition. I have to go to the hospital soon and get an ultrasound of my heart. I'm like, I was in shock. We were supposed to be home at this time. An ultrasound of my heart, a special kind of MRI, but they said that might take a while because insurance is like annoying with that. And I have to go and get an echocardiogram, which I'm like, cardiac stuff is the things I'm the least familiar with. And like crazy, like it just changed so fast. I was totally fine yesterday until after the EKG. I still felt fine after it, even though it was off. And then a few minutes later, it came on really suddenly. Of course, that's a symptom. Laying down is really hard, so I was trying to sit propped up last night with pillows and blankets, and that was hard because I'm just not comfortable at all. And I'm on medication for like the inflammation and the heart thing. And then I had a pancreatitis attack last night while this was going, and like I was needing medication in the middle of the night because it wore off. My blood pressure was in my normal range, which is low, but really normal for me. And my resting heart rate was over 120 when it's usually like 68. So that's never happened before, especially feeling totally fine. It was really, really shocking and really, really scary. I'm not doing any things right now that can raise my heart rate. Like, I don't want to go on the little exercise bike, even if it's 5 minutes, like, because my heart rate's so high at resting. I'm kind of like worried, like what it would be if I were to like go up and down the stairs 10 times doing laundry, not even like exercising, but just doing extra moving instead of just like sitting and watching Netflix, which is what I'm gonna go do in a few minutes. But yeah, we're really shocked. We talked about the possibility of Lyme carditis, myocarditis, and pericarditis, and she said the pericarditis made a lot of sense. Why it happened, we don't know. She said there's a lot of, testing that's faulty, and of course that's like Lyme. So she's like, well, this could show this, but you can still have pericarditis and it not show up. And I hit every symptom in the box. I'm gonna show a little bit about pericarditis in this video at the end, but I was just like, it's freaky to know that there's something like wrong with your heart area, like cardiology. Why is my heart beating so fast? It's just weird. It's really weird. it's definitely unsettling. And it hurt after I ate dinner a lot more yesterday. And I looked up pericarditis worsen after eating, and then it said your pain will most likely increase when you're laying down, eating, or after you eat, and like all these different things. And I was like, are you kidding me? Like that lined up too. So it was very, very scary because like your heart muscle is really important. But I obviously have a whole lineup of tests coming. And we're getting closer and closer to the moving date, obviously, which is exciting. I haven't had a meltdown about leaving the house in a while. I'm sure I will again, but right now I'm just gonna try to stay calm and not exert myself physically. If you have any questions or comments, please be sure to comment them down below. It was a crazy day. It was totally unexpected, and it's just like unbelievable. Like how the heck is this happening? On that note, I'm going to rest for a little bit and hang low for the rest of the day, and I will be sure to talk about how the tests go and what it was like when I go and do those tests. They're not all together, so there'll be at least like 3 videos about it, and then I have to go for a follow-up. So there's gonna be a lot of cardiac videos lately. New stuff, new content. Thank you, and I will see you later.
The heart in the chest is surrounded by 2 layers of what's called pericardial tissue, and anything that causes inflammation of that tissue is acute pericarditis.
Kim says pericarditis can be caused by anything from a viral infection to a bad reaction to certain types of medicine. Even a common upper respiratory virus can trigger it. The symptoms?
Typically the patient comes in with a fairly distinct story. Uncomfortable chest pain. It can be very positional in nature, meaning when the patient is lying flat, the pain is worse. Sometimes they get relief leaning forward.
Treatment options, Kim says, depend on the cause. Keep an eye out for these signs.
Certainly any sort of new onset, very uncomfortable chest pain associated with shortness of breath, other generalized symptoms, anybody should be checked out.
But he says you're more likely to think you're having a heart attack, so get to a hospital immediately.